Good afternoon, everyone. Thank you also for being here so late in the afternoon on the first day. And I would also like to thank the organizers for giving me the opportunity to be here. It's certainly a great privilege and pleasure to be here. So I'm going to talk a little bit about supply chain management and one particular approach in supply chain management, segmentation, and how it can help improve access to products and access to services. So I think just to start with, I think over the past 10 years, people have recognized that supply chains and product availability is critical to delivering quality services. And so I think the benefits of a strong supply chain and a well-managed supply chain are first and foremost the availability of products where and when they're needed for customers and healthcare providers. But I think there are a couple of other benefits that you get by having a strong supply chain management system as well. And one of those is increased access to data on the quantity and volumes of commodities that are being given to clients or used in the health facilities. And program managers and policymakers can take that and triangulate it with their own health service statistics and give them a much better view and more well-rounded view of what's actually taking place in service delivery sites. And so it can help them understand where there might be challenges and then where there are opportunities for improvement. And also a strong supply chain and supply chain management system can help deliver accountability for the products that move through the supply chain and are ultimately delivered to customers. Given that the investment in products is typically a very large portion of the budget that's used to deliver services, providing this accountability can provide program managers and policymakers with comfort that their resources are being used wisely. So I think that well-operated supply chains are critical to achieving an AIDS-free generation. If we don't have the commodities available to deliver services, we're not going to be able to meet the goal of an AIDS-free generation. In general, public health supply chains manage hundreds, if not thousands, of products, and the products they manage are not limited just to HIV and AIDS-related programs. They manage products for family planning programs, malaria programs, maternal and child health programs, non-communicable disease programs, immunization programs. So there are a wide variety of products that move through a public health supply chain in most of the countries that we work in. And those products have different characteristics. The facilities that they go to have different characteristics. So trying to manage that wide diversity of products with one simple set of rules is not going to lead to optimum product availability for any of those products at any of those facilities. So what are we going to do about that? So one of the things that the commercial sector has been doing for a number of years, and especially over the last 10 years, they've started to put even more emphasis on this, is supply chain segmentation. And the commercial sector has been interested in this because they've had to figure out how do we really optimize our service to our customers while at the same time minimizing the cost it takes to actually deliver to those customers. And to build segments, what they typically would do is take a look at their customer characteristics. And for public health supply chains, I'm using health facilities as a surrogate for our customers. And they have a variety of characteristics that you would want to think about and then make them potentially different. Seasonal variability, so some facilities have different demand depending on the season. Not all facilities provide the same services, so they're not going to consume the same products. Not all of the facilities are the same size. Not all of them can store the same amount of product. Not all of them are accessible at the same time throughout the year. So facilities have different characteristics that you can use and build a segment around. Same thing with products. Not all products are the same. Some have a short shelf life, some have a long shelf life. Some require cold chain, some don't. Some are high value products, some are not. Some are bulky, some are not. Some are vital, some are essential, some are necessary. So when we build segments in a supply chain, what we do is we take a look at the data that are available to us about the customers or the health facilities and about our products, and we put together bundles of products and customers, and we call this a segment. And then you would do that for different groups of products and different groups of facilities. So you have to sort of ask yourself, okay, well that sounds great, but how many of these darn segments are you going to have? And so you want to minimize complexity as well. So one segment clearly is not going to be enough, as we talked about, because not all products and customers and products are the same. But you're not going to have 100 of them either. So most, I would say, somewhere in the 5 to 15 range would be about as much as you would want to try to manage in a supply chain. And you can see here that there are just some nominal or notional segments. Short shelf life products might move along with one set of policies and procedures that are used to manage them. High value products might have a different set of policies and procedures that are used to manage them, and cold chain products might have a different set of policies and procedures. So for each segment, you're going to define a unique set of policies and procedures for managing the products that move through that segment and to the customers that receive products in that segment. But one thing that's important to mention here is that even though you may have a number of different segments in your supply chain that are differentiated by customer and product, they are still managed as one whole. You're not creating separate parallel vertical supply chains that are independent of each other. What you're doing is you're creating segments that you're managing as one unified supply chain. So let me give you a couple of examples of where we've applied this and the reasons why we did it and what some of the results were. So for lab products in Zambia in 2007, laboratory products for HIV programs were frequently stocked out, leading to service interruptions. Not a good thing for an HIV care and treatment program. So in taking a look at the lab system, working with the Ministry of Health, with implementing partners, with our PEPFAR colleagues on the ground, we designed two different segments really for laboratory products. The first segment included laboratory controls, which are very short shelf life products which were frequently out of stock. In fact, their in-stock availability at the time we started was about 30%. And then there was a second set of procedures for reagents. And within those procedures, we actually had separate inventory policies for fast-moving and slow-moving reagents. So for the short shelf life control products, what we did was after the controls were received at the warehouse, they would be sent by courier immediately to the laboratories that needed them, thereby making sure that they were available and that there was plenty of shelf life left on those products when they arrived. And the improvement in availability was from about 30% available to about 95% available. For the reagents, they followed the standard ordering and resupply procedures, although the inventory policies were slightly different for each. For the fast-moving ones, we increased the inventory level slightly to make sure that facilities didn't run out. For slow-moving reagents, we lowered the inventory policy slightly to make sure that they weren't overstocked. The availability of the reagents also improved, although not quite as dramatically as for the controls. So as you can see, the availability for the controls increased to 95%, and this was for over 200 laboratories in Zambia. This was evaluated in 2011, and the availability improvements were, as I said, 95% for the controls and about 80% for the reagents. So a significant improvement. I have to say, in a disclaimer, in 2014, the availability levels have dropped a little bit, mostly due to upstream financing issues. So somewhat unfortunate, but I think it's a reminder that all supply chains are integrated, so you can't fix one piece of it without fixing the whole thing. So this is an example where a segmentation by product characteristic. So in Zimbabwe, there's the second example. Over the last 10 years, there are about 4 separate parallel supply chains that were created to be able to deliver different categories of public health products to facilities throughout the country. This included antiretrovirals, contraceptives, test kits. As the Ministry of Health takes over more and more control for the operation of these systems, they were concerned about cost. They said, we're having to deliver 4 separate times to these facilities. It would be great if we could figure out how to consolidate these deliveries into one system so that we could save some money. So working closely with the ministry, we designed a new system, a new set of supply chain policies that included 2 segments. The first segment included health facilities and health centers at the lowest level, and a supervisor would go out to those health centers and work with the staff to calculate the order quantity, would bring that order back, and then that order would be packed and delivered from a central facility. So there would only be one delivery instead of 4. But there would still be an emphasis on collecting the data and making sure that the data came back to the central level. For large hospitals, in fact, it turned out that because of the volume of the products they received and the number of items that they received, it didn't make any sense to shift from the previous system. So in fact, they are going to continue to do multiple deliveries where what they call a rolling warehouse goes to the hospital, calculates the order quantities, and delivers the commodities on the spot, because there were not going to be any cost savings because of the nature of the commodities and the quantities that were being used. So this is a pilot that's ongoing now, and we hope to have results in towards the end of this year, first part of next year, and to be able to demonstrate that in fact we were able to improve efficiencies and save money by merging these systems and by the development of these 2 separate segments based on facility characteristic, and to show that there was no net decrease in product availability at the health facility level. Because one of the things that everyone, including the ministry, is concerned about is that in the previous systems there was a very high level of product availability, and we had access to data about what was happening at the site level. And there are concerns that with the integration of these systems that we will lose some of the product availability and data access gains that have been made over the years. So stay tuned, and we'll be able to say more about that in a few months. So in conclusion, obviously products and customers have different characteristics. Segmentation can be used to improve service levels and/or efficiency across products and customers. I have to say, you can't typically do both things at the same time. You can't get better service, and you can't make it cheaper and more flexible all at once. You have to make a series of trade-offs, and so that's part of what segmentation helps you do, is to identify what are the priorities and how are you going to deliver them and when are you going to deliver them. Segmentation can also facilitate merging disparate program supply chains into a common supply chain under one control structure. As we saw in the Zimbabwe example, you can take 4 separate delivery systems, merge them into one, create separate segments that respond to different facility needs, but managed under one control structure to gain efficiencies. And then, as I said, the pilot is ongoing in Zimbabwe, and we should be able to provide some additional information on both the availability impact and the cost impact of the merging of those systems and the creation of the 2 segments. One other thing I would say, based on some of what I've heard so far at the conference, is there's been a lot of conversation about hotspots and the need to target interventions. I think supply chain segmentation offers a mechanism for being able to also target the commodities that are needed to those hotspots. You can develop policies and procedures for making sure that commodities are where they are needed if you're designing interventions that are targeted specifically at areas of high prevalence. So keep supply chain segmentation in mind if you're designing those kinds of programs. And finally, I would just like to acknowledge the Ministries of Health in Zambia and Zimbabwe and their essential participation in guidance and implementation of these 2 activities. I would also like to acknowledge PEPFAR and USAID for their funding, and the SCMS project and the USAID Deliver project who provided the technical assistance for all of this. Thank you.